Hey guys, Dr. Ross here with Inver Chiropractic, and today I'm going to be talking to you a little bit about diabetes. Now, diabetes comes in two forms. We have type 1 diabetes, which is an autoimmune. We're born with it, our body's attacking itself, and there's really not too much that we can do about it, as in reversing it. There's definitely a lot of treatment that you can do, but I'm going to focus on type 2 diabetes, which is the most common form. About 90 to 95% of diabetics are type 2, and the nice thing is about type 2 diabetes, there's stuff that we can do to help change it and hopefully even completely reverse it. So there's a lot of things you guys can do, which is super exciting. So the numbers and the different blood tests that we look at for diabetes, especially type 2, we're going to look at our fasting blood glucose, we're going to look at our hemoglobin A1C, and then something to test before that would be our HOMO-IR, which is insulin resistance, and then also, your insulin levels as well. So with those four numbers, we can really see where you're at, whether we're on our way to becoming a diabetic or if we already are. But what I'm going to focus on is HOMO-IR. So that's going to see if we're actually insulin resistant. And the reason I really want to look at this is because this is one, if we're starting to creep up and become insulin resistant, it's going to increase our risk for becoming a type 2 diabetic. And type 2 diabetes is on the rise. It's actually skyrocketing right now, and it's actually the 7th leading killer in the United States. So it's super important. It definitely can be deadly, and it's something that we can prevent. So what we want to do is check our HOMO-IR, which is looking at a ratio of what is our fasting blood glucose and what is our insulin levels. And when we're starting to become insulin resistant and our HOMO-IR is starting to creep up, it greatly increases our risk for things such as diabetes. And when we have diabetes, it increases our risk for a ton of other things such as cardiovascular disease. So it's super important. So we want to make sure we get our numbers checked. Most medical doctors can easily check this for you. They can get your blood drawn. If you're a patient in our office, we use Boston Heart Labs, which does a very in-depth look at the blood work, and they send us the results, and then we can go from there. So if you are, you might think that you're getting some symptoms of diabetes, or you've had a family history and you just want to know, make sure you get those four things checked. We want to see what is our fasting blood glucose, what is our insulin level, and then what is our hemoglobin A1C, and then we can calculate the HOMO-IR from there. If you guys have any questions about diabetes and why it's important and things that you want to know about it, please comment below. I'd love to help you guys out or point you in the right direction. Otherwise, share this video if it's something that you guys think others would benefit from. Otherwise, have a wonderful day. Thank you.